Welcome to Patient Care System for Infosys Hospital. Here we demonstrate certain intelligent features of a patient care system developed at Infosys Limited at the Center for Knowledge-Driven Information Systems, Infosys Labs. This system assists doctors and healthcare providers in making their decisions by offering guidance and keeping track of the patient's diagnosis, tests, and treatment plans, along with their semantic and functional relationships. The doctor is presented with a list of patients who are to be diagnosed. You can notice that Mr. Charles Dent, 72-year-old male, needs attention. He presents symptoms of pyrexia, diarrhea, fatigue, muscle weakness, breathlessness, and in his history, it appears that he had traveled to Pune in India within a certain time frame. As the doctor decides to focus on Mr. Dent, the system retrieves the state of care for this patient and presents tools and resources for the next activity, in this case, possible set of diseases. On the left-hand side, the doctor can see the history, signs, and symptoms of the patient collected by the hospital staff. In the middle panel, he can write down a list of possible diseases. On the right-hand side, the system provides guidance by recommending other possible diseases in terms of related material and evaluations that the system might have with respect to the signs and symptoms of the patient. As the doctor tries to identify a possible set of diseases, the assistive engine estimates the doctor's intention to identify a possible disease and generates recommendations on the right-hand side. In this case, it has found influenza, avian flu, and swine flu. But swine flu, interestingly, has been highlighted, which suggests that the internal score is low, but it has some additional information to show to the doctor. In this case, the external support data found by the system consists on a collection of news articles talking about swine flu outbreak in the city of Pune during the time Mr. Charles Dent visited this place. The assistive engine had noticed that some travel information had been saved in Mr. Charles Dent's history and finds any disease outbreak in that location during that time frame. So even though the score for swine flu is less, it has been pulled up for recommendation. The system also shows details about the patient's symptoms which are matching with the symptoms related to its disease, the additional symptoms that the patient has but are not matching, and also the rest of the disease symptoms that haven't been found in the patient. Now the doctor tries to enter a disease name based on his own understanding of the signs and symptoms. The assistive engine knows that the doctor might want to write a disease name in the text field, so it generates a list of suggestions of this particular class of information based on the characters being typed. The doctor can also drag and drop diseases from the recommendation panel. In this case, the doctor has chosen potential diseases as avian flu, influenza, and swine flu. Notice that the system recommendation is low on swine flu, so the doctor is being asked, "Are you sure you want to consider swine flu?" He says yes, and he goes on to validation of these diseases. The next activity is to order a set of tests to be performed in order to confirm or disprove the previous set of possible diseases. In the middle panel, the doctor can see the suggested tests, which are based on the standards of care for each of the possible diseases. The doctor can also choose from a complete list of tests available at this hospital and its partner organizations. The doctor is able to visualize which tests are related to the differential diagnosis of a particular disease. In this case, the doctor chooses every test suggested by the system and proceeds to place the order. Now, the doctor waits for the results to come back. The test results for Mr. Charles Dent arrive, and the doctor continues to diagnose him. The doctor can see the exact test results in the middle panel, while in the right-hand side, a new set of scores has been generated for each disease, this time considering the test results. The doctor can also explore the results of the test with respect to each disease, showing a positive or a negative evaluation. Back to the central panel, the way the results are presented is by showing the expected normal range and highlighting in red the tests which are outside this range, which gives the doctor an advantage to focus only on the elements which are abnormal. Similarly, here you can see that in the test real-time PCR, the result shows swine influenza virus found, which is flagged as the normal value would indicate virus not found. Based on all this data, the doctor seems to have confidence that the disease is swine flu, and he confirms it. At this point, the system is going to learn that even though it does not identify swine flu based on these symptoms, it is actually relevant, but based on the news report and the location where the patient traveled. This way, the next time a patient with similar symptoms or travel history comes in, the system uses previous information to give an updated score to the disease. A new patient, Mr. Chris Edwards, presents similar signs and symptoms with also history of travel to Pune. As the doctor tries to enter a possible disease, the assistive engine learns from the previous actions that it should place more weight on swine flu based on patient travel. You can see that the score of swine flu is more than what we have seen before. In this way, we have demonstrated an activity context-aware guidance for patient care systems.